Hello, welcome to my mini lecture on Talia Welsh's article, Healthism and the Bodies of Women, Pleasure and Discipline in the War Against Obesity. And I'm going to pull up a concept map and try to lay out the main arguments in that article. So the background against which Welsh is writing is thinking about what does it mean for certain kinds of problem behaviors or problem bodies to be targeted by governments, discourses, ideology, media, for change. So to say this kind of behavior is harmful in some particular way, and we create policies, government structures in order to change that behavior. And we start off with an analogy between obesity and smoking. And the idea is, well, smoking has fallen out of favor due to medical research linking it to cancer and public health campaigns that are trying to influence behavior. And in so doing, smoking has gone down. Therefore, if there are similar problems, they can be targeted in similar ways in order to prevent those issues. And so I would say coming into the early 90s, obesity is really taken on as a social problem. There's lots of research explaining how those shifting categorizations of body size are flawed, and then also were changed in the 90s to kind of create a sort of crisis frothing about. That's not really Welsh's focus in this article, but there's lots of literature in her bibliography that outlines that. But anyway, we have an analogy here, so we're going to take a particular kind of prevention approach. And what Welsh is discussing is how both of these approaches in taking on public health measures presume something called the good health imperative. So this is the idea that rational subjects should want and should take every available avenue possible to improve their health. And if not, then they are irrational and, by extension, moral failures. So when you're talking about the good health imperative, you're saying if you do something that's harmful to your body, you violated the good health imperative. Okay. So the first social stab, even though it's number 2 on my list here, but let's start with the first stab that governments and policymakers take towards prevention in that analogous way with smoking. So we come up with policies. So these policies, I'm sure you can rattle some of them off as well. They're listed in the article. Taxing sodas, adding a kind of environmental approach where you have walking paths promoting biking, public community gardens. Just think about large-scale social interventions meant to improve the food that we're eating and the way we move our bodies within its target reduction of obesity. And so what justifies these policies? Because if we're going to start interfering in people's lives in sort of a liberal democratic society, normally we have to have justification. Here what we're getting is, well, there's a drain on society in terms of healthcare money, which of course many of us are drains on society in all kinds of different ways, but when does that become a problem? Who becomes a problem in that way? Another one is sort of responsibilizing modern consumption as the sort of special fault of obese people in this discourse, especially for environmental damage. And then also, what's going to happen to our nation? We're not going to have enough fit citizens to be in our military. So that justifies the kind of governmental approach. Now, there's also, and this is what I think is really valuable about Welsh's intervention, is to talk about sort of feminist implications within the war on obesity. And so it's pitched in terms of feminist reasons. So there's feminist specific reasons to target obesity prevention through public health. One is, well, women do the majority of caring, and if they're sick or if they're disabled, then they can't take care of children as well. And so there's feminist reasons, right? We're helping women to implement these public health measures. The other one is that it's just sort of better for health, with the limitation and critique that it's not just about looks. So we've absorbed the feminist critique that dieting to look a particular way is wrong, right? That's because of patriarchy, and we shouldn't be doing that. But if you're dieting or taking on a lifestyle change for your health, then that's absorbable within a sort of dominant feminist lens. And so keeping in mind then that that means we're still on board with good health imperative public health measures. Moving along, we have working with and around the good health imperative is health at every size. So this kind of says, look, a lot of the ways that we've been talking about health are misguided. We need to actually think about health in a sort of more complex and comprehensive way. So we can think about if a public measure is targeted to the health of someone's body in ways that detriment their mental health, then that is not okay. And so we have to balance that and sort of keep in mind that, and health at every size people are dialoguing with doctors, they're dialoguing with public health professionals, and they're trying to advocate for the better inclusion of larger people within policies so that they have access to health in a more equitable way. And so there's lots of good research on health at every size as being, more sustainable, more inclusive, and allowing, I would say, question marks around the healthfulness of obesity within mainstream medical discourses. I'm not going to say anything's been undermined, but I think they're introducing really big question marks. And then in response to the good health imperative, we're looking right here, I think Welsh brings out and discusses sort of the fat activist resistance too. So here you have the idea that public health measures, which exemplify the good health imperative, are unfairly targeting fat people and making them feel worse about their bodies, making them feel socially excluded and marginalized, and actually they are socially marginalized, and they're basically saying that there needs to be space for more equitable worlds of bodily value, bodily neutrality, bodily value, and the possibility, the outside space, allowing for people that might not want to change their bodies, or don't want to change their bodies, or don't want to be targeted by prevention measures such as for smoking. And so they're going to say, look, if you want to work together with health at every size, that's great. These two areas are mutually informing and in dialogue with each other. But the fat activist resistance is about undermining this kind of link here, that there are similar enough features with smoking to obesity that they then justify intervention and surveillance in everyday life of fat people. So, what is Talia Welsh? So Talia Welsh has laid the groundwork for all of these responses to and identified the good health imperative. I think I have to just increase the size of my frame here. So just to put this all together, Welsh's view is that approach 1, feminist reasons for the good health imperative, approach 2, health at every size, and approach 3 all presume a certain kind of subject who's self-governing, who can either listen to their body and respond in the health at every size paradigm, or within the fat activist resistance, that they can sort of use their mind to govern their body in terms of how I think about my body. I'm going to change my mind that my body is negative based on these public health messages that I'm getting, social messages that mark my body as a problem. And so they all presume control over the subject. The subject has control over their body, their health, their mind, and they all try to regulate in some way pleasure, whether that pleasure is food or exercise, right? They're saying essentially that if you take pleasure in dieting, that needs to stop, but also that you should take pleasure in certain kinds of healthy food in the right way. And so Welsh is also saying that all three of these paradigms sort of ignore the attachments that we have to eating. I think here we have 1 and 2 the most, but most certainly the anti-obesity policies ignore attachments to eating and sort of regulate the exact way that people are supposed to eat in order to be healthful. Extreme examples of this are, diet plans that ask you to have like 4 containers of different size and color, and you just put your food in them and you eat your Lego bricks for the day. It ignores those affective attachments that we have to eating. And all of them presume that it's irrational to do unhealthy things. So this is where the fat activist bit gets implicated in the good health imperative, where it says, in order to be, let's say, a good activist, you need to have good thoughts about your body. You need to feel love and positivity towards your body. Otherwise, it's unhealthy for you or bad for you. And, a lot of people, and especially our society is extremely fat phobic, that is an extreme imposition. It's basically saying this is how you need to feel about your body. Now, I think that this characterization of fat activism is a bit dated and a bit one note, but there is good literature sort of talking about how lots of different sort of activist communities suffer from this sort of myth of the perfect activist who can, purge themselves of all of the influences of oppression, and that's a really sort of oppressive notion. And so Welsh brings in Foucault to talk about how all of these, through the good health imperative, are actually disciplining bodies by regulating pleasures. And so when we're disciplining and regulating pleasures, we're sort of saying this pleasure is too extreme, this pleasure is permitted. So you can have a cookie, but it needs to be in a 100-calorie package, right? Or you can diet, but don't diet too much. Don't diet to the extreme that it puts your health at risk, right? And she talks about, we really have to deal with how in a society that has so few offerings for self-expression, pleasure, and sublime and extreme experiences for women, that extreme dieting experiences do offer that sort of sublime pleasure that takes you near to a kind of extreme limit experience, like Foucault talks about in these quotations in Welsh's work. And we also have to think about how discipline produces capacities. And so when we're trying to say, this thing that you're eating that you're taking pleasure from, get rid of it, we're also saying that the capacity that you developed around it needs to go away. And then that is more sort of connected to one's sense of self. Okay, I'll stop there. There's lots more to talk about.